So we are going live, we're officially live, I'm standing over here, I'm gonna project my voice a little bit better. So everybody, welcome to the clinical room. All right, so for your Prometric CNA examination, you have two tests. One test is a written test, it's on a computer, multiple choice. How many questions?
60.
60, and you have 90 minutes. I need you to be to the test site on time. What
30
time
minutes.
are you late?
1 minute.
On
So-
time
Seconds.
is late.
So if you arrive at 9, your test has started, you've already forfeited a portion of your fees. So I need you there 30 minutes before your test. And so once you're at the test site, you'll be greeted. We don't know which test you're taking first. You could be taking a computerized test first, or you could be doing the clinical skills test first. So let's say it's 6 of you on the test site, and they can test 8, 12 students per day. So plan on being to the test site all day. You 4 will be doing the written test first on the computer. Let's say it's 2 more students in here. The other 4 would be preparing for the clinical test, but 1 pair at a time. For the clinical test, how many skills total, including hand washing and gloves? 5. How many minutes do you have based on the skills?
30,
31 up to
41.
41, and the computer picture skills. You will perform the skill on another test taker there, unless the skill involves what? A mannequin, so nudity. One of the beds will be dedicated to a mannequin. One of the beds will be dedicated to a human. The mannequins at the test site are not as lightweight as the mannequins we have here. Those mannequins are a little bit sturdier, they're about 50 pounds or more, so you're really going to get the feel of really moving somebody. As we progress during the class, I'll teach you how to move somebody who can't move themselves, but outside of that, if it's a human in the bed, they can move, they can do anything you ask them to do. A human will not be dead weight during the test because that will cause injury to, could possibly cause injury to a student. So if 2 of you are in the room, the nurse gives you an orientation to the room before you ever know your skills. So I'm going to give you an orientation now. All right, so everybody, welcome to the clinical room. Above the beds, we have our clocks. In the real world, the clock would not be above the patient. In the real world, it would be opposite the patient. So that if you have a person with Alzheimer's or dementia, sometimes they're always asking you, what time is lunch, what time is lunch, what time is my family coming? You keep reorienting them by pointing them to the clock. Test site, this clock is here so that you and your nurse can keep track of the time. I don't want you wearing a watch in your test for the reasons I already mentioned, but if you're a person who just have to have a watch, keep it in your pocket, okay? And so you and your nurse will use that timepiece. The cabinet behind me will have gloves. It has ADL supplies. What does ADL stand for? Everyone say activities of daily living. Give me an example of ADL. What did you do before you came to class this morning?
Wash your hands.
Wash your hands, wash your face, brush your teeth, eat breakfast. You actually were able to walk to the car, get into the car and drive. If a person does not have a deficit with an ADL, more than likely he does not need a CNA. So usually they need assistance with something or you wouldn't be there, okay? At the test site, they're gonna have bedpans in the cabinet. We don't do this in the real world because we know what that cabinet would smell like. But this is where your bedpan for your bedpan skill will be located. Normally it's on the bottom shelf with the toilet paper. In the real world, there's a T-shaped wire rack in the bathroom. Once you rinse out your bedpan, you allow your bedpan to air dry in the bathroom, but that's not an option during your test. Notice one of our beds has rails, and the other one does not. During your test, you're not passed nor failed on the presence or the absence of side rails. Your test is not geared toward a hospital, nursing home, or home care. So don't assume you're in a hospital with those fancy beds. I call this Eunice's nursing home. You're in Eunice's nursing home. Some of our patients don't even want side rails. They're not a fall risk. What prevents a fall is a good caregiver. Patients, even if you have the side rails up, what will they do?
Still scoop out.
Climb over the rail and still fall. What would be a way that you could prevent a fall without tying somebody down? We talked about it before.
Put it on the
The bed alarm. So bed alarm's on and then move fast when you hear that alarm going off. Also to prevent a fall, we don't raise the height of our beds here during our class. Because if you're working home care, the bed they have is the bed they have. You don't have the ability to elevate the bed to a working height. In the nursing homes and some of the expensive nursing homes and most of the hospitals, they're gonna have the electronic beds that raise up. During your test, if you raise this bed up to a working height and you forget to lower it, what's gonna be the outcome of your test? Fail. So for your test, I need you to hurt your back just for 3 skills. Get it done. Don't bring that bed up because you have so much to remember, you may forget to lower it and cause yourself to fail your test, okay? The brakes will already be locked, so that will be a non-factor. At the very top of the bed, and our beds are well utilized, so this handle is broken. It has Velcro, you can reattach it by using the Velcro that's at the top of the bed. This is our bed controller, head, feet. This is what most CNAs do. Oh, I'm about to raise you up. I'm going to raise you up. Uh-oh, I think it unplugged. There we go. I'm going to raise you up now. Oh, my bed isn't working. My bed isn't working. My bed isn't working. Just keep pressing the button. Eventually it's going to catch, okay? So that's the one that's going up. What is this device called?
Nurse call.
Okay.
Call button.
Yep, and so this is what you want to leave in their hand before you actually exit the room, so they have a way to call you. This, you can call it a tray table, a bedside table. It has a lever on the side. Whenever you activate the lever, by squeezing it, you can raise the table up, move it to where you need it to, and then whenever you're lowering the table down, I recommend you use your hand as a buffer. Put your hand under it, because if this table hits your patient's leg, it can just hit it a slight bit. The patient may verbalize that you hurt them. So if you stop lowering it when your hand hits their leg, there's no reason for this tray table to hit their leg. Keep your tray table as clean as possible. Only clean items go on top of your tray table. We don't put bedpans on top of tray tables. We don't put bedpans on top of surfaces that people have to eat off of. Do you put dirty linen on the floor?
No.
Okay, and so we have a laundry basket down there. In the real world, they're gonna have, like a rolling laundry basket or whatever that you can take to your residence room, or at least outside the room, and you can take the dirty laundry outside. You'll have the bag on the inside. When you're done, just take the bag and take it outside to the laundry area. Katrina, can I get you here? Everyone see this crank right here? This is how old this bed is. One day Eunice will have a new bed that doesn't have a crank. So everybody, this is how, and that's fine, this is how you raise and lower the bed. This one's a semi-automatic bed. If you leave that crank out, what type of risk do you cause? Fall risk. So if you ever have a bed with a crank, what do you have to do at the end? Put it back under. All right, and so then we have our linen racks over there. It also will have food, because you may have to feed someone during the test. ADL supplies will not be meat. So when we talk about the hamburger, the meat of your skill was you gathering your supplies. I think page 103 in your book has an equipment list. So each skill has its own equipment list, but if you just want the simplified version where you can make your own study card, because at the test site, if you don't get your equipment, you don't fail, but what do you have to say? Correction. Go back and get what you need. And the way that you're not going to forget is by preparing in advance. Write down information about your skill, write down the equipment, so when you go to the test site, it's second nature. These are the curtains that I installed. Be gentle. All right, because at the test site, you have to provide privacy. And then our room in the back, whenever we need to use it for a bathroom, I take, what is that device called? BSC. Bedside commode. I take the bedside commode and sit it next to the sink. At the test site, you may not have an active working bathroom. Wherever the bedside commode is that's next to the sink, we're going to consider that our bathroom. So whenever we have to empty the bedpan, this will be our bathroom, okay? What questions do you have about the general layout of the room? Any questions?
I mean, how many chances they give you if you have to pay another fee if you fail?
Yeah, so let's say that you tried to transfer somebody from the bed to the wheelchair and you did not lock the brakes.
That's a failure.
You failed. Let's say you did the skill and you didn't wash your hands before you touched the resident.
That's a failure.
That's a fail.
Or could we say correction,
So
and then correct it?
depending on what you're trying to correct, if you're about to transfer a person midstream and the brakes are not locked,
You already lost your patient on the floor.
no, we're stopping your test. You failed. Hand washing, if you remember, that's something that could be correctable. But if you don't remember the process, more than likely you're not going to remember to wash your hands. So that's why process is so important for us. And speaking of that process, we're gonna start it now. And so I'm gonna pretend that there's a person in the bed and I'm going to do the orientation. This is not about you. I'm gonna do the introduction. This is not about you right now learning a skill. This is about you learning a process. And then after we learn the process, it's when we'll do the skill called pulse, okay? We're gonna pretend this is our second skill. So if it's our second skill, do we physically have to wash our hands?
Yeah. Oh,
No.
No. What skill do you physically wash your hands
First
for?
skill.
First skill. So when I say that I'm gonna go wash my hands, I'm gonna pretend as if you all are nurses. And when I say I'm gonna go wash my hands, I want you to respond by saying hands are clean.
clean.
Come in. Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? Yes, it is. Before I begin, let me go wash my hands.
Hands are clean.
Hands are clean. Now I can touch whatever I want to in the room. I have clean hands. There is no sanitizer during the test.
You don't put on gloves before you.
No.
What's the
not
name of the
violent.
skill?
We're just doing,
Pulse.
Pulse.
Do we wear gloves during the pulse
No.
skill?
No.
Nope, so no gloves. May I take this call, Bill? Cause she doesn't need it if I'm in the room. You can put it on the bedside table. Sometimes I put it under the pillow. Just make sure it's not uncomfortable. All right, so I have HCC. When you get to this point, I'm gonna say fast forward, your skill is done. Because this is not about you learning the skill right now, it's about you doing the intro and the exit. What are the 4 letters for my exit?
HCCD.
HCCD, all right, good memory. I'm right next to her, and you all know I have a hip issue, so I'm not walking backwards and forward too many times. I'm right next to her, I'm gonna give her this call bell and ask her what question.
Is there anything else I can get for you?
Perfect, and she said no. Now as I'm walking towards the bathroom, what can I do with this curtain?
I asked her, does she want to open or close?
And pretend at the test, we're gonna just go
Just
ahead and
open
open it, okay? Because we don't wanna leave them claustrophobic. Does Pulse require you to write anything down?
Yes.
Yes. So if you're not going to remember your number, pick up your pen and document your number before you wash your hands. You'd only have to wash your hands, first if you had gloves on. So let's say I was emptying out a urinary drainage container, I had gloves on my hands, I can't pick up my pen and document with those gloves on. I'd have to take off my gloves, wash my hands, and then document. Does that make sense?
Yeah.
So if it's a gloveless skill, you can pick up your pen and document, and then the last thing you do is wash your hands. At the end, don't say you're done. Because if you move really fast, you may forget something. I want you to come to the corner, call out 4 letters. What's those 4 letters?
HCCD.
How many times will you wash your hands?
Once,
Mm-mm.
twice,
Twice, beginning and
Enter
end.
and
Oh, yeah.
Okay, where should the call bell be at the end of your skill?
in her hand.
How should the curtain be at the end of your skill?
Open.
Let's say you forgot to close your curtain. You don't freak out, it's at the end of your skill. What do you say?
Correction.
And I didn't tell you this, you'll know if you have to document because your nurse will give you a documentation form, and that's what you all have there in your hands. Were you first during hand washing?
No, ma'am.
Okay, looks like you're first now.
Oh,
Okay, all right, so let me get in bed. I try to, all right, and so you'll start off at the door, and you keep that in your pocket, because you're not in the room just yet.
You took off your shoes?
Yeah,
Somebody lay in the
I
bed.
gotta get in bed. I need them fancy shoes that she has on. I like those.
Oh, these sketches, baby, my favorite.
I used to wear a lot of Skechers, so. Now cool socks. Okay. Hi, come in.
Hello, my name is Katrina. I'm your CNA today. Hi, Miss Eunice.
You got a hip walk going.
She got that paid CNA walk
I'm
going.
going to do your pulse today.
Okay.
Is that okay?
Yes, ma'am, it
All
is.
right.
No, you have not messed up.
Okay. I'm sorry. I'm going to go wash my hands.
What do y'all say?
Hands are clean. Hands are clean.
Okay. All right. Is it okay? Can I remove your call here?
Yes, you can.
Okay. Thank you.
There's a lady looking at me from over there.
Yes, ma'am.
Correction.
Good job.
Correction.
And she hasn't, she hasn't started skill yet, so it's fine. And now we're gonna fast forward, your skill is done.
Okay.
So do the exiting procedures.
Okay. I'm going to hand you back your call bell. Is there anything else that you may need?
Not today.
All righty. Thank you.
You're
You have a
welcome.
great day.
You too.
Gentle.
So, what you doing now?
documenting.
Okay, all right, good, and now the documentation's done, what else do you have to do?
I have to wash my hands.
All right, tell her what, everybody.
Hands are
All
clean.
right, stand at that door for 5 seconds, in your head, call out those 4 letters, and did you do everything?
HCCD.
Did you
Yes,
do it?
ma'am.
Give her applause, everybody. All right, so you're walking the cycle out, you can either go over in that corner, next person. Hi, come in.
Good morning, my name is Sharon at the pool, I am the CNA for today, I will be doing your vitals, is that okay with you?
Yes, ma'am, it is.
Okay, I'm gonna wash my hands and I'll be right back.
Okay, awesome. What do you
Hands
say,
are
ladies?
clean.
Hands are clean.
Hands are clean,
That lady keep looking at me.
Correction, curtain. Oh, sorry.
You gonna do it last?
Close the curtain.
Correction. Go do it. You was over there, so I just wanna save y'all here.
I didn't touch it, so in my mind, okay.
No problem. So whatever you're nearest, just touch it while you're there, if that makes sense. Okay, now you're over here with me.
Okay,
Now, none of that would have failed you.
okay. I'm gonna take this.
Okay, fast forward, your skill is done.
Here's your call bell. Would you like anything?
Not at this time.
Would you like your curtain open or closed?
Don't ask that question at the test. Undo what you did.
Correction.
Nothing correct, just keep on going.
Okay.
So I did have this one student who corrected her way through the whole test. She wasn't even making mistakes. She was just saying correction.
Say it, say
So go ahead and open it. And now it's the last 2 things you have to do.
Wash my hands,
Hands are clean.
hands are clean, HCCD,
What does the D stand for?
document.
Very good.
Do you HCCD before you wash your hands?
So
or
at the
before
end,
and
the
after?
order doesn't matter.
Oh,
Just get it
okay.
done.
Okay,
The
thank you.
order only matters in the beginning. Make sure you start off by washing your hands after your introduction. You can put that in your pocket if it's a distraction.
That's the thing, I don't have a pocket. Oh, yes, I do. All right.
Hi, come in.
Good morning, good evening. I don't know what time it is right now, but my name is Miss Francois. I will be your nurse CNA.
Okay,
If you don't mind, can I get your call back?
you cannot touch me. Cause you have not sanitized.
Shit.
Start all over again. Start all over again. Sanitize your hands. Remember, I told you if our students fail, what do they fail? Hand washing,
Yeah, okay.
okay?
Whew, okay. But don't I come to you first and let you know I wanna wash my hands?
But you came to me first and tried to touch me and take
Got it, got it.
Touch them until your hands are clean.
Got it. So I shouldn't even get close to you. I should get more to your
So
feet.
what's the foot?
Okay.
Hi, come in.
Good. Hello, my name is Miss Francois. I'll be your CNA today. Give me a second while I go wash my hands.
Why did you come in my room to wash your hands? You can do that outside my room?
Ask for permission.
Oh.
I'm
Well,
here.
actually,
To
I'm
do the
lost.
vitals.
So
Outside.
you have to tell me why you came into my room, cause you could have washed your hands outside of my room.
Okay.
So let me rephrase it. My name is Eunice. I'm your CNA today. I'm here to take your pulse. Is that okay?
Okay.
Old people are suspicious. You just can't be walking in their room talking about, I came in to wash my hands.
Okay. Got it.
Why?
Why is this part so hard for me?
Okay, you got it. You got it this time.
Okay, I got it. Do I?
You do. Alright,
Don't think about it.
come in.
That's the problem. Hello, hi, my name is Miss Francois. I'll be your CNA today, taking your pulse.
Is that okay?
Is that okay with you?
Yes, it is.
All right, give me a second while I go wash my hand and I'll be right back.
What
Hands
else?
are
Wash your
clean.
hand.
Hands are
Hands
clean.
Okay. Correction.
Good.
May I take that from
You
you?
certainly can.
Thank you.
Fast forward, your skill is done.
Wait, before I fast forward, correction, pause.
Mhm.
What if they say, no, I can't take this from them?
At the test site, if they say no, the nurse fails them.
Oh. The
Only
nurse-
focus on the test site. If I say no at the test site, the nurse fails me. I paid my $155 just like you did, and I wanna pass my test.
Okay,
So no one's gonna say no.
okay, got it. So, put that down. So now, fast forward.
Breathe,
Okay, thank you.
breathe. Take a deep breath in and out. Fast forward, your skill is done. HCCD.
Okay, I will be handing you your call button back.
Okay, thank
Is
you.
there anything else you would like me to help you with while I'm here?
Not at this time.
Okay, thank you. Washing my hands.
Hands
Hands
are
are
clean.
clean.
Okay. I'm opening up. I'm documenting.
Okay, and then
Then I'm going to
call out those 4 letters.
HCCD.
Did you do everything?
Did I do everything? I document, I wash my hand, I open up. I told her,
So
so
yes, you did everything.
Yeah.
You just forgot
You
yourself.
overthink it.
Give her applause, everybody. Alright, so next.
it's the fact that they have to play in my head.
And then if you can step away from the camera just a little bit, and then don't forget that it's recording, so when you go home, you can watch it again.
Okay,
Okay.
thank you.
Alright, come in.
Good afternoon.
Good afternoon.
Hi, I'm Ms. Hall. I'm your CNA today. I'm going to be doing vitals on you. Is that fine?
Yes, it is.
Okay, I'm gonna wash my hands.
Okay, Tina.
Hands are clean.
Hands are clean.
Okay. Okay. Can I have that?
You certainly can.
All right.
You missed a step.
Yeah, the curtain.
Oh, God. Correction.
Got that correction now.
Alright, so fast forward, your skill is done.
Okay. Would you like your call bell back?
No. So don't ask me. Pass your test. Here is your call
Oh,
bill.
here's your call bell.
Thank you. And what's the next statement?
All right.
Be proactive. What's the next statement?
Is there anything else you need?
No, not at this time.
All right. Have a good one.
You too.
Wash my hands.
Hands are clean.
Do you open it first, then wash?
That's what I was trying to see.
I would, if you can remember, make hand washing the last thing you do.
Okay.
That way, but in the real world, you have hand sanitizer. I don't need to distract you. You're not done. Call out HCCD.
HCCD.
What did you miss?
Document.
Oh, documented.
All right, so just make sure during the test that you don't forget to document. All right,
Okay.
great job, everybody.
Okay.
All right, and so remember, you're not gonna be, just looking for the camera, you're not gonna be at the test site with these ladies, so don't, give them at least 3 seconds to try to pull it forth before you tell them the answer. All right, next. Hi, come in.
Hello, my name is Jamaica. I'll be at CNA today. I'll be taking your vitals. Is that okay?
Yes, it is.
I'm gonna wash my hands so I can get to you.
All right, team, what do you tell her?
You clear.
Hands
Oh,
are clean.
Good. All right. Here, you can put the paper on the bedside table. Okay, there you
Is it okay if I take it?
go. Yes, you can. Thank you. All right, fast forward, your skill is done. Okay,
Here's your call button.
thank you.
All right, you're gonna press that if you need any other assistance. Is there anything else I can do for you?
Not at this time.
All right, thanks. I'm gonna go wash my hands.
Hands are clean.
And document.
Very good.
And you gotta call out.
Very HCCD. Okay.
Oh.
All right, last but not least.
Thank you.
Hi, come in.
Hello, my name is Eunice. I will be here CNA today. And I'm just here to take your vitals.
That's fine.
Is that okay with you?
Yes, ma'am.
Okay, wonderful. Let me just wash my hands really quick.
Team.
Hands are clean.
Alright, may I?
Yes, you can.
Thank you. You're too kind.
Fast forward, your skill is done.
Alright, well, now that we're done here, I'm gonna give you this just in case you need to call me now. So, other than that, I just wanted to, ask, is there anything else I can get for you?
Not at this time, Shanice.
Oh, holler if you need me. Well, other than that, I'll be not too far away, only one call away.
Okay.
And then I'm gonna close this up.
Don't close it.
Oh,
I wanna see the
open it
sunshine.
up,
There we
open
go.
it up. I'm gonna wash my hands.
Hands are clean.
Good.
HCCD,
What does the D stand for?
documentation that I
Very good. Very good. All right. And so when you're at home, you don't need a call bell. You have remote controls, you have cell phones. Practice with that. You don't need curtains, you have doors, you have blinds to your windows. You can provide privacy by utilizing those items also. And so just keep practicing your introduction, because that's going to make that nurse feel more comfortable with your care. If when you walk in, you start off confident. We can tell the people who properly prepare versus the people who just act like they're in the hospital. Hey, hey, I'm here, no.
Yeah.
Because at the test, in the real world, once you've introduced yourself to your patient once, you're not doing this every time you come into a patient's room. At the test site, you have 3 skills. And even though I may be your partner for 3 skills, you treat every skill as if it's a new resident. And every time you walk into a new room for the first time, what do you have to do? Knock, okay? And any subsequent time too, because they could be exposed, and you want to give them a chance to cover themselves.
Right.
Can your patients have intercourse?
No,
Yes, they can.
Oh.
not on your watch.
Your patient 30, he's in the hospital with a toe infection. He's getting long-term antibiotics in the hospital. Ain't nothing wrong with the rest of his genitals. Something's only wrong with his toe. Do you want to see it?
No.
No.
So you mean to tell me he can
Yes.
have
Yes.
conjugal visits in
Yes.
the hospital?
Yes, in the nursing home too.
I didn't know that happened.
So what do you tell the nurse? We busy?
No, I ain't tell him
He
nothing.
didn't say you can come in.
Right.
Oh, okay.
They don't give you a chance to say you come in. They just walk on in.
If you
why
were
you
trained
knock.
by me, you go give them a chance to
Yeah.
Come in.
the state.
Ooh,
No,
I
give me
learned
5
something new
minutes.
every
No.
That's I definitely.
So yes, you call it a conjugal visit, but you don't own these patients. You don't own these residents. As long as the person is coherent, they're not hurting anybody, they can have their adult pleasures. You just don't want to see it.
Right.
All right, y'all good now? She laughing.
Yeah.
But that.
Why are you thinking about that? You and her.
You talking me?
I'm saying the
Oh.
patient. You
Oh.
in here being service. You why is that? Why
Doing
is that on
sex
his
ed-
mind?
Doing sex ed education.
Cause he's something wrong with you. You ain't been.
But that's self care, to be honest.
Child, you know how these men be at home. They still want it.
I'm just happy that I forewarned you all
Yeah.
because you would be like, why is he doing this? Because
You ain't
he's
break like
human.
this. Like, what's gonna happen to him?
Traumatized.
She should have told me this when I was married. But that's like now. Oh, we recording? My bad.
It's fine. Hey, if they don't know our personality or my personality by now, they just found out in this video.
Right.
Because I need to prepare y'all for what y'all about to see. All right. And so, would you please take off those shoes and lay on top of the bed over here for me? We're gonna perform the skill on you first. Got this? Yeah. Remember, you weren't here for our introduction, and I said that if you don't get in the bed, you don't get to practice.
Okay, you're right.
Yes, your fancy shoes. If I can get you in the bed first over here. Yeah, take your shoes off.
My baby doll shoes that's
Baby
worn out.
doll. Cute shoes.
Oh,
And then as far as my CNAs, shoes are fall hazards.
Oh, this bed feels good. I'm sorry.
No, you're fine. Would you make sure that call bell doesn't drop? Thank you so much. So shoes are fall hazards.
Oh, my
So-
toes ain't done. Sorry.
And if you'll give her pen, thank you so much. Our patient is so distracted right now. All right, so let's talk about the shoes being fall hazards. So if your patient's in the bed, I don't want you working around their shoes. When they're in the bed, you slide their shoes under the bed. When you're done with their care, what do you do with their shoes?
Slide it back out.
Slide them back out. Because right now, if I'm walking around and I'm not paying attention, I'm gonna trip on their shoes, and that's not safe for me as a caregiver. So first thing I'm gonna do is put your shoes in, and then the second thing I'm going to do for classroom purposes is I'm actually going to pass around sanitizer. At the test site, there will not be any sanitizer. At the test site, how do you clean your hands?
Wash
them.
soap and water.
Okay. No yawning, no yawning. Put you in the bed.
She
for
got
one
comfortable.
moment. I know,
It's the
one
bed.
moment. Can I have you come over here, please? I can only get you to get one more chair, a folding chair. There's one in that room to the
Hey, we
left.
did bring
So
it.
y'all did
It's
this
right there.
early?
Oh, it's right here. It's right here.
It's right here.
Y'all did this earlier.
No,
Oh.
we read the first, and it's gonna be on that side over there. Thank you so much. And then if you can take that one, Miss Full, that chair right there. And then what I'm gonna do is just have you sit on the bed over here. Can you scoot over just a little bit? At the test site, your nurse may be sitting on the bed. If she does, there's not enough room for you, of course. So you're either gonna have to find a chair. She could be in the chair, she could be in the bed. If there's not enough room, you have to squat or kneel. So if I can get you to put the chair off to the side over there by her. So you're gonna sit on the bed, you're gonna get a little bit closer. Can I get you to come around over here?
sit in the chair.
Go ahead and have a seat, have a seat, have a seat. All right, so talk to your partner, because this is the part we fast forwarded. We fast forwarded on the actual pulse skill. Ask your resident, your patient, is it okay if you get their arm?
Is it okay if I take
You're
it
doing
off?
it together.
okay.
Mhm. Okay.
Is it
And
okay?
now, if the hand is up, what happens when the hand is up? If you think about circulation, what happens?
Germs,
Blood flow, circulation. So I need for both of you, because one is the CNA and one's the nurse, to go ahead and participate, Ms. Poole.
You ain't asked me.
Yeah.
Oh.
Thank you. My hands are cold.
All right, and so one hand has to support. One hand has to support. Your elderly patient is just gonna lay there for a whole minute. If you feel like you're
You can relax.
overextending the resident's arm, scoot up some, get in closer.
So am I, we're doing a pulse?
Right now, we're just talking through the basics, cause
Okay.
her hand is still up, and your patient's hand shouldn't be up. Lower it, lower it, lower it, lower it, lower it, okay? Probably support with your right hand, go under and support. Feel for the pulse with your left hand.
Okay.
But
I'm
you
waiting for you.
touching me and I'm touching your clothes.
So you may wanna scoot
Can
back a
you-
little bit.
They can't extend it out like this?
If it's up, what's happening to blood flow?
Oh, it's not
So scoot back some, scoot back, okay, and now your thumb is in the way. There we go, lower her arm, lower it, lower it, lower it, pulse is right here. Lower her arm, get comfortable. Do you feel the pulse where you
Yes,
are?
ma'am.
Do you feel the pulse where you are?
Yes.
Okay, you can't feel the pulse with your thumb because your thumb has its own pulse. So what I recommend you do. Let's see you get the pulse on your side. Do you have it, Katrina? So now everybody, do you have the pulse?
Yeah.
Yes. You're a nurse, Katrina, you're a nurse. You're a CNA, Ms. Poole, you're a CNA. Our clock has that second hand that's moving fast. You just don't wanna say start. And you also don't wanna be counting the ticks on the clock because that's gonna distract you. Don't take your hand off the pulse, make sure you're in position. I need for you all to start, and what you're gonna be counting is those thumps you feel against your finger. And you're gonna count those thumps for how many seconds? 60. So whatever number I tell you to start on is the same number you're gonna stop on.
Okay.
So you all would start on the 6, you all are gonna start on the 1. When you're done, don't call out your number. Perfect, everyone stop, pick up your pen and your paper. Write down capital P as in pulse. Going back to the room, get your paper.
You got it?
No, I do, but,
Write down capital P as in pulse.
I got it.
And then the number that you counted. And then once everyone has written the number, what's going on, Ms. Poole, what's going on? That's how it does, what's going on?
We can't say nothing. We gotta do this together as a team.
So what number you got? Okay, so what we're gonna do is, if you lose count, did you lose count?
No, when the 6 came and I took my hand away, and when the 6 count came, I lost the pulse. So I just,
So what can we do to not lose the pulse?
I should've,
Kept your finger on it?
I didn't wanna apply pressure before time, so I waited till the 6 to apply pressure,
Gotcha,
and I lost it.
gotcha. So you all,
I didn't wanna
when
squeeze
you're,
her.
when you're talking to your nurse and you're letting, or the nurse is telling you what number to start on, you had like a 10-second window. But technically, you shouldn't get started until you both have the pulse, and I checked on everybody and I asked, do you have the pulse, and everybody said yes.
Mhm.
So don't let the pulse go once you have the pulse. How the young people say, if you stay ready, you don't have to be
I
ready.
didn't wanna squeeze her, I didn't
But it's
wanna,
not squeezing her, it's making sure that you don't fail your test.
okay, yes, ma'am.
$155.
Got
So what number did you get?
70.
Okay, let me see your documentation, make sure a P's in front of your number, 75 and 85. And so that would be a significant enough difference to where we would either be withholding medication from somebody or giving them medication. So we don't wanna be 10 off, but it's your first time doing it, let's do it again. Don't you lose the pulse in the pool.
Don't be scared.
Right, and so I was
I'm
concerned
not
about your
really
hand
understanding
placement.
this.
I was concerned about your hand placement, cause it looks like your index finger was overshooting her. Okay? You sure you have a good pulse? Lower that arm. No, so the pulse is gonna be right, so maybe you feel it. Ms. Poole, you got it? Don't be afraid to.
I kept losing because it feel like it kept stopping.
And so when they rest, what's gonna happen with their pulse?
It's gonna slow down.
It's gonna slow down, and you just slow down with it, okay? Ms. Poole, can I help you? And most of your older patients will be also. So the first thing I ask you to do is turn towards this clock like everybody else. Turn your body, move your chair closer.
Now, I'm gonna remind you, just because I'm 39, I do have age in trouble, so I might be like a senior.
There we go, bring this arm
No,
out.
I'm being serious, because I'm not being funny.
Okay, so I want you to hold with this hand. I want you to bring this hand over. Use 3 fingers until you get more comfortable. If you press too deep, you're going to kill it. Let me know when you feel it. Got it? Do you have it also? Nurses and CNAs, do you have the pulse?
Yes.
Got it. You didn't say yes?
Yes.
Yes. You all are gonna start on the 2. You all are gonna start on the 8. 2, 8. Write down your numbers, don't call them out. They got a good nap. They've been laying in the bed for a while. Wake up, Shanice, wake up. All right, so we'll start off with this team. What number do you have?
80.
Oh, sorry, she was still right.
I was there when I had 69.
You got
Really?
69.
Yeah.
Oh.
So it was like her
It
pulse
was going down.
It was like fainting.
But I still, cause I was, trying to make my son go to sleep a little bit.
That's fine. They'll be partnered with me next. 'Cause we gotta get to those
Okay,
closer.
yeah.
All right. So what I'm doing, I need you to label it. It just can't be 73. What goes in front of 73? I don't see a P.
Come on, miss.
I see a weight. I see a blood sugar. Oh, now it's a pulse.
Yes, ma'am.
73. What number you have?
66.
Y'all got closer. So what I want you all to do, because my babies who are in the bed need to practice.
Okay.
And so, let me figure this out.
I let know.
Thank you so much. Okay, so Shanice, come on up, baby.
I was trying to find your shoes on.
It's on this side, but that's okay, we gotta go. We'll figure it out later. You know how the game go, that's why you had your socks.
I'm glad I did.
It don't feel comfortable.
Oh my God, I forgot your name, Rena,
Deviana?
Viviana. For this one, you'll stand up.
Okay.
And so what you can do is you can be my assistant if somebody needs help.
Yeah.
Okay.
So we asked for Miss Matt.
Okay, and then Shanice, I'm gonna get you over here. I wanna make sure that you all are set before I get started. Do you have pen?
I got my paper, I got my pen.
Okay, good. Shanice, you got everything you need?
I can put it right there.
Yes, you certainly can put it on the table. I don't want it to be a distraction. Shanice, what you doing? Why you writing in advance? She like, look, I'm labeling it now. I'm not mad at you. I want you all to go ahead and locate the radial pulse. Move that arm, move your body, do whatever you need. One hand has the support. That feels uncomfortable, doesn't it, Shanice? So go ahead and move in closer. Bring that arm out towards you. One hand supports and the other hand locates. Okay. So usually we have it like this. Right, there we go. And so if you're gonna hold with this hand, feel with this one. 2 fingers on the radial artery. Thumb underneath to kind of support. Don't overshoot. Are you comfortable where you are?
Anything.
Do you feel the pulse like where you are? Bring her hand back a little. It's gonna make sense when it makes sense, like bend her hand back a little. And now come closer to this area. Instead of using 2 fingers, I recommend you use 3 fingers when you're starting off.
1, 2, 3,
Mm-hmm.
but I feel comfortable with 2.
Okay, do 2. Do 2 if you feel comfortable with 2.
Okay.
Shanice, do you have it? Press in deeper.
Now, how did you do the clock?
She's not ready yet. We can't start until Shanice has a pulse. Shanice, do you feel anything?
I don't know why I'm not feeling anything.
Switch hands. So move her body around, move your body around till you're comfortable, okay? You're milking her fingers and I don't know why. I need your hand on her radial artery.
Okay, I was trying to have her hand to be straight, but okay.
But you see her hand ain't cooperating anything. And press, no ma'am, press down and press in.
I feel it.
You feel it? Okay. Do you still feel yours?
Yes.
And so what happens is you use the clock as your starting and ending point, but the clock can be a distraction because of the ticks. And so let's just say, for example, we say start on 5.
Okay.
You would keep counting those pulsations you feel hitting your finger until that second hand, the one that's moving faster, gets to 5 again. That means that was 60 full seconds or 1 full minute. At the end of that time, you let go of the pulse, you pick up your pen and you document.
Okay.
Okay, so what numbers do you 2 ladies wanna start on? What number?
10.
I'll start on 11.
So we gotta start on the same number, ladies.
So 11, she said, let's go.
Okay.
My mind went blank.
You want the counter?
I did.
Y'all are not talking to each other, so how are you doing it again if you're not communicating?
I was gonna start on the same number.
No, you have to communicate. What number you starting on?
Are we starting on the 11 again?
Yeah, 81.
So if you'll please step out so she can come in.
Listen. Let's start at, 10.
I had 58 the first time.
And so what I'm gonna do is, since they're done, is I want you two ladies to come over here. Okay, very good. All right, and so this will be the last time, so just bring that chair over here, thank you so much. You want me to get up? And then, you'll come over to this chair over here, and then Ms. Poole, if you just wanna take your nap for a minute, you can. Right there. All right. And so, let me help y'all get this organized so you can get this pulse. What's your heart rate normal, Ms. Poole?
I'm not sure.
Okay. And of course, the phone will ring right now, so I'm gonna let you all at least find the pulse before we get started. Very good.
What number you wanna start?
No, ma'am, you gotta make sure she has the pulse. Okay, so whenever y'all starting on. Write it down, I have a strong pulse.
You sure do.
Mhm.
You-
That's
You're
all
going
you
in
do.
my own.
You really do.
I hope the person that I do.
So what we get?
75.
I have 75.
Very good, ladies. So if you two would please fold those chairs and, just put them up against the wall somewhere. And then Ms. Poole, if you'll get out the bed, because the last skill we have to do before we take our next break is gonna be respiration. And you all are doing a great job, so
So this will be the 60 to,
100, 60 to 100, yeah.
this next one will be 20 to.
12.
12 to 20, good job. Okay, so once Ms. Poole gets over here, we
So
can
this
get
is skill
started.
2.
This is also a skill, and so even though for classroom purposes, we may not be doing a full intro, bless you, at the test, these would be two separate skills. So if you just happen to get pulse and respiration, you would have to exit, knock again, come back in, and do a whole nother intro before you did respiration.
Oh.
The, exception would be, you can't say the word respiration, what do you say instead?
Vitals.
So can I get you to scoot over just a little bit? And then Ms. Poole, come on, because what I want you to do is to all have the same viewpoint. And so whenever you're counting someone's respirations, you're either watching their chest rise and fall or their stomach rise and fall. One inhalation plus 1 exhalation equals 1 respiration. So you're not counting every time you see the chest or the stomach rise or fall. It's 1, 2. When someone's hyperventilating, that's a bad thing. You're gonna notify the nurse. When they're barely breathing at all, notify the nurse. That's a medical emergency. I'm going to close my eyes. I'm going to focus on my breathing. You can't say the word respirations because you want to make sure that I don't get, that I don't change my breathing pattern. Something else that may happen is during the test, your nurse may be sitting on the side of the bed holding the wrist. She's tricking me into thinking that she's taking the pulse. But your card says respiration. So she's really not taking the pulse. She's keeping her hand on the pulse. And the whole time she's gonna be counting my chest rise and fall. So don't get distracted if you walk into the test site and your nurse is sitting down, but your paper says respirations. You go sit on the other side and you count respirations also. All right, so I'm gonna be quiet and you all talk to each other and you all are counting together, but just choose a number.
Okay, I think on 8 we can get started, if you all agree. What, 9?
Y'all talk, do y'all agree?
Yes, 9. Let's go.
And time.
Okay, pick up your papers and pens, put a capital R in front of the number. The R stands for what?
Respiration.
Vitals.
All right, and then we'll start off with you, Ms. Poole. What number did you get?
18.
Keep going.
Oh, I got 9. I didn't know when we were starting at 9. I didn't know if we started on the 8. That's fine. I would've got 18 if that was the case. Okay.
Communication is really important, you all.
That's the
time
time
is up.
No, I was saying we were starting on the 9 on the hand. We
You
were
know
starting-
what, that's my fault.
Starting
I'm looking at
respirations.
short inhale and exhale.
Yeah,
You
that's
might
what
start
you're supposed to do.
But
But
you're supposed
on
to-
9, we start counting.
Okay, well, I was looking at the clock.
Okay, so we're gonna
Alright.
do it over
Yeah,
again,
you
so
watch
that, and
the
this
clock.
time you go lead. But
Okay.
when we say start on the 9, we're talking about that second hand.
Okay.
Yeah, and so, what number did you get?
18.
What number did you get?
18.
18.
And so for this skill, you could be 2 off from your nurse's number.
Okay.
You're now the nurse. I'm gonna go back to sleep again. You're gonna
Okay.
tell the team what number to start on.
Okay.
And when you tell them to start, guess what you need to do?
Yeah, I can.
Sorry.
Start watching my chest rise and fall.
Okay.
And you would stop whenever it gets back to your starting number.
All right. We can start on the 3.
here so you can lead. What number do you have?
I got 19.
19.
19.
20.
Very good. At the test, how far can you be from your nurse's
1,
number?
2.
And she will never let you know her number. And so after this, don't forget that you were HCCD. For classroom purposes, we did not do an intro and exit, but for every skill you get during the test, you have to do a full intro and a full exit. What questions do you have before you go back in the room and read? All right, so no questions, I'll meet you back in the room, okay? Great job, team. There's sanitizer in the room. Great job.
Do these chairs need to go back?
Yes, but it's fine, you can take them back later.